Hello, everybody, and welcome back to our How To Corner. Today, we'll be talking about knee replacements. And I'm Dr. Will Gray, your friendly neighborhood therapist. Before we get started, please like, share, subscribe, comment, ask questions in the comments. Let us know what you want us to discuss, and we will definitely do so. With that being said, let's get going. Now, the agenda for today, we're going to discuss what is a knee replacement, the reason for knee replacement, the procedure, the types of knee replacements, recovery time, benefits, risk, and complications, as well as returning to work activities or any activities. First and foremost, let's be simple here. What is a knee replacement? It's basically a procedure that involves replacing damaged components of the knee, the joint, right, with artificial implants. That seems very simple. I promise you, if you watch a knee replacement surgery, it is not that simple, which is why the reasons for a knee replacement is super important to understand. Usually, most of the time, when you have a knee replacement, you have osteoarthritis of some kind. Maybe you have RA. Usually, RA happens in small joints, but then again, it can start to have an issue attacking other joints. Post traumatic arthritis or severe injury or deformity. In short, there's a lot of reasons why this can occur. For the most part, there's usually a certain age group that it occurs in, our older age group, between the ages of 60 to about 70. Sometimes it's 55 or 50 because also depends on your external factors, which is what was your lifestyle when you were younger. Did you have any accidents or incidents or anything like that? Can speed up the process of joints degenerating. And did you take care of yourself from a health standpoint? You know, how your health is in that nature as far as like, being overweight or being diabetic or having certain things that don't allow you to be able to be as active possibly, or maybe you are overactive, right? Now, the procedure, believe it or not, it is like being in a butcher shop. Oops, I said it first. Yeah, it's basically a procedure that's removing the damaged cartilage and bone. And with that, they're going to implant an artificial component, metal, plastic, titanium, all that beautiful stuff. And the surgery time is about 1 or 2 hours. I've seen them go a little bit longer. I have an issue fitting the actual prosthetic or the artificial joint into the bone. It's a very, 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 very specific type of surgery, which is why the surgeon that you choose is important too. They make the procedure be, what it is. There are some masterful people out here who do a great job of repairing our bodies. And the knee replacement is one of those procedures that you will want to have one of the best surgeons if possible. Now, types of knee replacement, right? Wow, like, wow, knee replacement, not a knee replacement. No, there are types. You have a total knee replacement, you have a partial, and you have a revision surgery. They're pretty much self-explanatory. The knee replacement that's total is going to cover the whole joint, the femur, as well as the tibia, meaning bottom part of your joint, top part of your joint, left, right, up, down. And the partial may be an actual compartment of your joint. Usually it's the medial compartment, which is basically the inside part of your knee. And then the revision procedure is that in case something has happened, the actual prosthesis itself or the joint or something happened from a fall, maybe it's infected, needs to be revised because of those reasons. And they're just going back in there to do what they need to do to make sure it stays stable or maybe remove the hardware. Just depends. Now, recovery timeline. This is a very fun thing for me to talk about because obviously I'm a therapist. The hospital stays are getting to a point they're not even a hospital stay. It's like a same day surgery. So you go in, have the surgery, leave the same day. But there are situations where you stay to 1 to 3 days. I personally think that an overnight stay is proper. Just because there are some issues where the person that's probably getting the replacement doesn't like this guy in this video, nice and young. They're a little bit older, so sometimes they may not have a caregiver, or they maybe need help if they do have a caregiver because the individuals are taking care of them. Maybe they can't assist, right? So that first night in the hospital is just to get them in a place of being educated, being comfortable before discharge, how they're going to discharge, where they're going to discharge, what's the actual process thereafter, and then the first 3 weeks or of your time out the hospital, you're doing rehab. Usually, rehab starts about week 3. Sometimes it starts day 1. Not day one, but the following, that first week. Really just depends on the preference of the physician who did this procedure. And then we're obviously going to be working on the ability of being able to be mobile. Some of that actual rehab is actually home health. They'll come in and help you be able to get mobile in your home. Very minimally invasive type of actual therapy. They're just doing what they need to do to make sure you're functional, right? Be able to transfer, stand, and move around. Now, the 1 to 3 months, right? That part, there's really not just a gradual return to daily activities that happens. That's a general term. We use that just to kind of say a general phrase. I'm sorry. We use that to kind of say that, hey, we're trying to get back. But truth be told, your range of motion is paramount. You have to get as much flexion or bending and as much extension or straightening as possible early. You can always go back and grab strength, but you cannot go back and grab range. If you're not able to get to a certain bend or a certain stretch or extension, the doctor needs to be contacted because that means there's something is afoot, right? Now, for recovery, 6 months to a year, it takes about a full year to really get that thing, dialed in. Because after the knee replacement, you're not out the woods. Your pain may be a little bit better, but or maybe not better. Maybe you still have some achiness, some soreness, because you have to heal. And guess what? You have to do things to make sure this joint lasts and make sure this joint continues to improve and make sure this joint is progressed to a point where it's not stiff. It doesn't stove up on you. So there's a continuous um, change in your lifestyle over and over that year where you have to make those adjustments to make sure that you're doing what you need to do to maintain your joint, right? Now, let's talk about the benefits of knee replacement. The benefit of knee replacement, we can reduce or eliminate pain, improve your range of motion. Maybe you weren't having that much range because your joint was very arthritic. Increase independence, get back to your life, man, what you were doing. And then long term durability. The joint itself, they're making improvements to it where they can last a lot longer. And it really depends on the individual, too. Just different reasons, how active they are, how their weight, complications of surgery, just a bunch of stuff. But on average, about 15, 20 years is the life of the joint. So if you get it at 60, at age 80, there may be a little difference in the joint, but maybe you're not as mobile. You don't notice it, right? Now, let's talk about the risks and complications with this. Infection, blood clots, implant loosening, like I talked about, which is where they're going and doing revision, right? Stiffness or persistent pain. You can have the knee replacement and still have pain. Is another thought. Why? Because sometimes that joint is not really accepted by your body like you think it is, and also sometimes you don't do the rehab because it hurts. So a lot of those things put you in a place where you really open yourself up for having that stiffness, persistent pain. And then sometimes the issue after the replacement is not the joint anymore. It's the muscles that surround the joint. They're angry, they're mad, they're weak. They're being overused. They just don't have anything to give you because you need to strengthen them back up. So you have a lot of persistent soreness from the muscles. There's just those risks and complications that nobody tends to talk about. You can have a knee replacement and still be in pain. Doesn't mean that the surgeon was wrong. It just means that there are some things that were probably missed as far as your recovery and the knee replacement itself when it came to the information thereafter that was given. So you have to be very aware of those things. Now, return to work activities. This is the fun part. Desk jobs. They say 4 to 6 weeks. I put this on here because that sounded good, but truth is that's not true. 4 to 6 weeks is a happy place. If you get there, great. If you don't get there in 4 to 6 weeks, because sitting may be a problem, that persistent swelling in your leg could be a problem. Okay. As a result, it may be 2, 3 months. It may be 8 to 12 weeks before you get back to your desk job. Now, in the physical jobs, you're going to be well above 3 plus months. It's going to be more like 6 months. Just loading that knee up, because if I got the range right, got the range back, may say it take you 2 months to get the range back. Let's just say that was the case. You have about a 2 month ordeal of just getting your strength back. So we say 3 plus months, with three being the gold standard, if that's possible. And then the safe activities you can do to make sure that you start to, how can I say this, make that lifestyle change: walking, swimming, cycling. Biking is beautiful, especially stationary bike. Avoid running, avoid high impact sports. Really do. Just avoid those. Take it to a place where that knee is strong enough to be able to return to it, okay? And then once you get back to that, thing you love to do, whether it's high impact sports or running or whatever, just realize you're very limited in how much you can do on this thing. And you will always have to be aware that it can cause some effects on the joint. So there's a give and take here. Now, last but not least, here are the take homes. Knee replacement. Safe, effective options for severe knee pain. Yes, definitely a safe option based on the years of study and how much it's done by a lot of surgeons. And it can be effective to help with severe knee pain. It can be. But there's some risks and complications that we list that can also come about. So don't be blown away if you're like, wow, I didn't really get what I wanted out of it. Probably a bit more needs to be done. Requires patience, rehab, and lifestyle adjustment. Patience, patience, patience. Don't go by a timeline, go by the milestones that you're getting to. Range of motion, how straight or how much you can bend your knee, your strength, your decrease of swelling, the decreasing of pain, and then the restored mobility and quality of life that comes with it. You should be able to return to some level of mobility, and quality of life should improve. If it doesn't, then guess what? There's something afoot. Make sure you're involved more than just sitting down and saying it's going to get better as I sit here at home. Because if you are not, you're going to be very disappointed in the results of the knee replacement. Because once it starts to heal and kind of sort of starts to take shape in your actual body, it becomes a difficult thing to change as far as how do we improve the knee replacement, right? Now, we want to thank you all who made it to this point of the talk. If you have any questions, please contact us. We're on all platforms. You can also contact us through our website. And please, again, like, comment, subscribe, share. Let us know what you think. And if you have any questions, again, let us know. And with that being said, hope you have a blessed one. I'll catch you in the next one.